Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in our previous session, as we have discussed in detail about what do we mean by body mechanics, what are the purpose, what are the basic laws, as well as what are the principles for a correct body mechanics. In this session, we are going to discuss about the various factors that can affect the body mechanics of an individual. As we know that body mechanics is defined as a process of using the alignment, posture and balance in a coordinated effort so that various activities which we perform in our day-to-day lives such as lifting an object, bending, sitting, standing or even movement can be done easily. If we maintain a good body mechanics, then all of these activities will be performed efficiently without having any trouble or discomfort. Whereas mobility means it is the ability of a person to stand, to walk, to run, or even to sit. So here, whenever any activities involves the movement of the body, then this is known as mobility. So here there are also certain factors that can affect your body mechanics, which include the congenital problem, the neuromuscular deficits, musculoskeletal deficits, chronic health problem, trauma, affective disorder, as well as therapeutic modalities. So here there are also various factors that can affect your body mechanics, which include the congenital problems, the neuromuscular deficits, the musculoskeletal deficits, chronic health problem, trauma, affective disorders, as well as the treatment modalities. So these are the various factors that can affect your body mechanics, and in order to get a clear idea of how and in which way they can affect, let us discuss about each one of it in detail. Starting with the first one, which is the congenital problems. Here, if there are any problems which are present since birth, then it can also affect your body mechanics, because these congenital problems usually affect the musculoskeletal as well as the neurological development. There are some problems such as congenital dysplasia, which can even be corrected with certain treatment. However, there are also certain congenital problems such as spina bifida or cerebral palsy, which cannot be cured. Whenever you encounter any client whose body mechanics is disturbed because of the presence of congenital problem, it does not mean that no treatment will be provided. Here, treatment will be provided with the aim of promoting the greatest degree of functional mobility and also in order to prevent the further complications from occurring. And the next one is the neuromuscular deficit. So here, any diseases that impairs the ability of the nervous system to control the muscular movement and coordination hinders the functional mobility of an individual. Here, if a client is suffering from any disorders such as muscular dystrophy, Parkinson's disease, or even multiple sclerosis, then these disorders are progressive, slowly eroding, and can also destroy the ability of an individual to move, which can ultimately lead him to become bedridden or to use the wheelchair. This is why if a person is suffering from any of the neurological disorder, then it can also disturb the body mechanics of an individual. This is the reason why if a person is suffering from any of the neuromuscular deficits or any of these disorders, then it can also disturb the body mechanics of an individual. And the next one is the musculoskeletal deficit. So here, any impairment in the musculoskeletal system can also affect the body alignment, body movement, the skeletal strength, as well as the joint mobility. So here, if the client is having any of the musculoskeletal disorders such as osteoporosis, where there is demineralization of the bones, then it can also increase their risk of fracture. And also, if he or she is suffering from rheumatoid arthritis, then it can also limit their movement, because once they move, it will cause them pain. So that is why even if the client is having an impairment in the musculoskeletal system, then it can also affect the body mechanics of that particular person. The next one is the chronic heart problem. So here, if the client is suffering from any chronic heart condition, then it can also decrease their mobility, because such disorders limits the delivery of the oxygen as well as of the nutrients to the muscles. And as we know that these substances are very important for the muscles to contract as well as to move, because of the lesser amount or the absence of these substances, then the muscles will not be able to move and contract properly. And because of this, it can lead one to suffer from various chronic heart conditions, which can also affect their body mechanics. And here, if a person is also suffering from any lung disorders, then it also limits the delivery of the oxygen to all the tissues, including the skeletal muscle. That is the reason why if a person is suffering from any heart disease or even from various lung disorders, because of this limitation in the delivery of the oxygen and the nutrients, it can affect the body mechanics of an individual, which can affect the mobility of an individual, because here, even if they just perform a small work, they will be feeling tired very easily. The next one is trauma. So here, trauma often results to injury in the joints, in the bones, in the skeletal muscle, as well as the tendons and the ligaments. Such damage can also be minor, but it can affect the body alignment and the mobility for a short duration of time. However, if there is a severe trauma, then it can also cause an excessive damage to the spinal cord or even to the brain. When the spinal cord is damaged, then it can also lead one to be paralyzed. Especially here, if the spinal cord is damaged, then it can also lead one to be paralyzed. And not only paralyzed, but sometimes the client may also be having paraplegia or quadriplegia, where paraplegia means decreased motor and sensory function to the legs, whereas quadriplegia is used to describe paralysis of the arms and legs. This is the reason why trauma can also affect the body mechanics of an individual. If the trauma is not very severe, then it can only affect the mobility for a long duration of time, and it can also lead to paralysis in case if this trauma had damaged the spinal cord or the brain of an individual. And the next one is the affective disorders. So here, severe affective disorders can also hinder the mobility of an individual. If the client is having depression or is in a catatonic state, then it can also limit their mobility, not because of the physical impairment, but because here the patient will be lacking the desire to move. So here, whenever you encounter any patient who is in a catatonic state or who is depressed, then it is very evident that they only want to sit in one place, will limit their movement, as well as if the patient is having fear, especially of pain on movement, then this will also restrict their movement. And the last one is the therapeutic modalities. So here, sometimes movement is restricted in order to treat a medical problem. Restrictive devices such as casts, braces, and even splints can be used in order to immobilize the particular area of the body which needs not to be moved in order to promote their healing. Because of this limitation of the movement in that particular area, it can also result to a negative consequences. As we also know that bed rest is one of the most common method which is advised for the client to take whenever he or she is not in a good state of health. So this is the reason why the mobility of an individual or the movement of an individual will be limited. A patient is usually placed on bed rest in order to promote healing, to relieve edema, to decrease pain, as well as to support a weak and an exhausted or a febrile patient. Because of the treatment modalities, because of the requirement of that particular client to take a proper rest and to limit their movement in order to treat a medical problem or a medical condition which they may be going to, it can also have a negative consequences on the body mechanics of an individual. These are the various factors that can affect the body mechanics of an individual. So now here we have come to the end of this very small topic, which is the factors affecting the body mechanics. Here we've come to know that there are 7 factors that can affect the body mechanics of an individual, which include the congenital problem, the neuromuscular deficits, the musculoskeletal deficit, the chronic health problem, trauma, affective disorder, as well as the treatment modalities. So I hope you have got a clear insight of this topic. I'll be meeting you in another session whereby we will be discussing about the various exercises that one may perform in order to increase the mobility healthy and to help a person have a proper body mechanics. So until then, have a good day. Thank you.